Hello everyone, welcome back to the course on Health Humanities, Indian and Western Medical Knowledge Traditions. This is lecture number 43rd on transmedicine and gender politics. In this lecture, I will talk about the health conditions of transgender, bisexual, lesbian, LGBTQ, and the people who are not conforming themselves to the binary of genders. So it is about the non-binary people as well as the binary trans people. So trans men and trans women, and then non-binary people. So in this way, this lecture is about how the people who are on the margins of society, they have access to the healthcare facilities, number one. Number two, how they have been perceived in the healthcare traditions. Number three, what are the researches available on them, and what kind of medical treatments they need, and how they have been treated, what kind of stigma they face, as well as how they develop a kind of understanding in the society where they can live with dignity and equality. So I'll begin by defining what is trans medicine, and and what are the problems in trans medicine, or what are the common concerns of trans medicine, and then how it works in the case of transgender politics. So the entire focus of this lecture is about the transgender people and their health concerns, their medical care needs. The lecture is based upon Steph M. Suster's book, Trans Medicine, The Emergence and Practice of Treating Gender. Most of the ideas in this lecture has been borrowed from the book called Trans Medicine. And it is she who has developed the concept of trans medicine and has made it popular. Before we come to define what is trans medicine, let us ask ourselves, who is trans? What do we understand by trans or trans people? So trans people are those whose gender identities differ from their gender assignments at birth, such as binary trans people who are trans women and trans men, and non-binary people, that is gender queer and gender fluid people, those who do not consider themselves either as a men or as women, those who belong to both genders, so they call themselves gender queer or gender fluid. So the trans people are those who are by birth men and women, but after a point of time they do not. By trans people are those who consider themselves, they have been assigned by their family, their parents, that they are boys and girls, they are male and female. But once they grow up, then they begin to believe that they are not what they have been assigned in terms of their gender identities. Rather, they find the space as in between male and female, or they find that they do not confine or they do not conform to the idea of binary gender divisions. Rather, they believe in non-binary divisions. They believe in non-binary people. So the idea of trans medicine is about how medical care has been accessed and are available. Moreover, how medical care define and designate the trans people, whether they are binary or non-binary people. The purpose of this lecture is also to understand the concept of trans medicine, which is one word, and then trans medicine as two separate words, then trans dash medicine. What are the differences between these three words? Trans medicine as one word, and then trans medicine as two separate words, and then the hyphenated trans medicine. Apparently these words look similar, and do not provide any very deep and critical difference. However, in my lecture, I am using it as a single word as trans medicine without any hyphen or without any space. The reason is that when we put trans medicine with hyphen, the hyphen is actually trying to put or differentiate that there is one something called medicine proper or normative medicine, and then it is different from the normative medicine, so it's a trans medicine. And when we put trans plus medicine separately, it implies that both of them are two different disciplines, and they have been put together. They have no connections. So in one case, one implies the idea of normativity, which has been imposed upon trans people, that is the hyphenated version of trans medicine. The other one, which is two separate words, that is trans plus medicine, it includes that medicine is one discipline and it has different concerns, and then trans are different area for studied different people, and then they have been clubbed together without any logic. So to actually avoid these differences, I have clubbed the word trans medicine as a singular word, as a single word, and when these words are combined together as a singular word as trans medicine, it is meant to develop a new kind of medical practice which is specifically devoted to trans people, which are meant for trans people, which is gender affirming medical practice. So the purpose, the idea behind putting a singular word is to make it gender affirmative and fully dedicated to trans people. The significance, when we look at the significance of trans medicine, what are they meant for? What role they play in the life of trans people? We find that trans medicine improves the access of hormones in the trans people. It provides them medical counseling, which helps them in their mental therapy. Further, it also advises them in terms of their surgical planning as well as their gender transformations. So what is trans medicine? Let us come deeply in this concept. And when we think about medicine in general, then we find that medicine in general affirms the concept of morality, ethics, values, certain kind of normative practices which are combined with the medicinal practices, medicinal sciences for the trans people. So when we look at the word trans plus medicine separately, they actually embody, they assert the conventional normative idea of medical ethics, conventional normative idea of morality, values, as well as the medical normative power which designates, which assigns, which defines, which creates one's identity. And in this way, when we see the word trans medicine separately, it actually affirms, it propagates the medical normativity, and this medical normativity suppresses, segregates the people who are not fitting in the conventional notion of gender identities. And when we think about how trans medicine works for transgender people or trans people, then we find that it is about affirmative medical interventions for trans people. So the word which is combined, it is about affirmative medical interventions for trans people. It is about the affirmative medical interventions for non-binary people who are gender queer, gender fluid, as well as agender, and many more other genders. So the one word, singular word, trans medicine is about the medical intervention about those trans people who are non-binary in terms of gender queer, gender fluid, and a gender. It is also about binary trans people who call like trans men and trans women. It is also about gay and lesbian people. It is about the homosexuals and those who are called themselves third gender. It is about LGBTQ. And what are like the access, how trans people have access to the medical practices. Then one has to think about the access to gender, access to transition, and access to healthcare concerns. In this way, one has to think about the access to gender transition related care. What is gender transition related care? It is about a woman becoming man through medical practices, through medical interventions, or a man becoming woman through medical interventions. In this way, the people who call themselves trans people, they also consider about the gender transition related care, which is about reversing one's sexual identity, that is from man to woman and woman to man. And it also focuses upon the goal of treatment in working with trans patients. And the goal is that when the trans patients are seeking treatment, and then does it maintain a binary gender expression, or does it not maintain the binary gender expressions? So the concerns of trans medicine is about the gender transition as well as about how the medical practices maintain as well as deny the gender binary expressions. When we go further about trans medicine, then the idea of gender affirming care becomes very prominent. Steph M. Suster refers to the such medical interventions under trans medicine as, so like what are gender affirming cares? And then Suster says that gender affirming cares are those medical interventions which are like therapy, hormone therapy like estrogen, which can increase one's breast. So we find like hormone therapy such as estrogen, testosterone, and then we have different types of surgeries like vaginoplasty and chest masculinization surgery. So when we think about like vaginoplasty, it is about how like a male is becoming a female, and then chest masculinization is about how a woman is becoming a male. It is about the sex reassignment surgery, that they have one assignment of sex during their birth, and now they are having under their sexual identity. They have under gender identity. So this is the reassignment surgery for sex. From male they become female, from female becoming male. It is also known with some different terms or concepts such as gender reassignment surgery or gender affirming surgery. The purpose of gender affirming care is also to support the mental care of or the mental health of the trans people, because trans people face the stigma of society, they face the brunt of society, they are marginalized and suppressed, they are humiliated by the society, and that causes a deep mental depression in them. The purpose of trans medicine is to take care of their mental health and to support their mental health. The purpose of trans medicine is also to provide accessibility of medical care to those people who are living in the remote rural areas, are those who are surviving or residing in the undeserved areas, who are far away, where there is no medical access. To put in a very simple way, it is basically challenging the idea of normative medical care and trying to fix or trying to reassign new concerns and a new aspect of medical care, which are basically associated with trans people. And it has also led to certain kind of socially as well as culturally assigned role change. So it is making a change in the roles of the people who are socially as well as culturally assigned. It can be like such surgery as vaginoplasty or chest masculinization. It can be hormone therapy such as estrogen. So the purpose is to actually affirm the gender care for the trans people. When we think about the author of the trans medicine, by the way, even she has challenged she has challenged the idea of a binary as well as a normative way of writing the names, that it should have. It should begin with what you call capital letters. Rather, she is writing her names with small letters. So this is also a kind of challenge to the normative medical care practices as well as normative practices of writing names. When we go further about trans medicine, there are certain questions which arises. One has to ask these questions that what are the resources and health services available for trans people? How much resources and health services are available? How often they are available? Where are they available? Which place? What time they are available? And so we need to like question the resources and health services for the trans people. Then we need to ask, is there any gender affirming care or any hospital specifically devoted for trans people? When we think about that, like how many hospitals do you know which are fully dedicated for the trans people? Have you ever come across any such hospitals, any such health centers, any such primary health care facilities? Let us ask another question. Have you ever consulted, met, heard about a trans medical practitioner? Have you ever seen anywhere? If yes, then what is the percentage of the availability of trans medical practitioners? How often one is consulting the trans medical practitioners? How often one has met them or heard about them? Even if you are not a trans people, then did you ever consult? Did you ever meet? Did you ever hear about them? And when we seek the answer of these questions, then we find that it has come down to the minimum. It has come down to the lowest level. Let us put it another way. Have you ever attended, heard of any dedicated health camps, conferences, workshops, seminars for trans people? This is something more academic, which anybody can attend. And there may not be any concerns of that one will be judging one's bodily as well as one's social identity. So how often one attended the conferences, workshops, seminars which are about the health of trans people or which are only about trans people? Again, the answer will be very low, very less. Can you think about the mental depression that they may have because of stigma and societal constraints? Because every day they are facing different types of violence. It can be mental violence, this can be the social violence, it can be cultural violence, it can be physical violence, and that will lead to their medical depression. And how much they face this violence every day, that is beyond descriptions. So the purpose of trans medicine is to put these affirmative questions and then resolve the problems which are arising for and for trans people and from the normative people for the trans people. In this way, trans medicine has a very broad social questions. It has a very broad questions of the rights of trans people. Let us go deeper about the transgender politics of health and how they access the healthcare facilities. And when we think about the transgender politics, then we find that they have faced a lot of historical barriers. And these are in terms of discrimination as well as lack of knowledge by the service providers. For example, like when a trans people goes to consult a medical practitioner, possibility is that he or she may be judged upon, he or she may be given a moral lessons, he or she may be asked that why she thinks so. Did she consult her parents? Did he consult his parents? And what are their response? So it raises a lot of questions. It also raises political debates. For example, that there are laws which restricts as well as there are laws which enables the access to gender affirming treatments. For example, recently in US, there is like a law restricting gender treatments. In India, there is now law enabling for gender affirming treatments. So recently, India has passed a law which is affirming the rights of the trans people. I will discuss this in the next lecture. Then we have to think about the impact of different policies on trans people and their health and their well-being. How different policies impact their health and their well-being. What are the accessibility they have? How often they have certain kind of medical interventions to help them to deal with their hormonal problems or to deal with their gender transition concerns. And this also is like who are then trans people or transsexual people. They are the people who have undergone medical interventions for a gender transition. So once like the trans people go for gender transition through medical interventions, they are called trans people. Let us talk about the politics, like how the trans people have access to the healthcare and how they have been perceived. And what are the problem, the moral ethical problems they face, the moral and ethical questions they face. This is an episode which Suster has cited in her book The Trans Medicine, where she notes down about like a young doctor who actually is asking a transgender like who's a young doctor who is attending a transgender healthcare conference. He gets up in the dark room and then asks this question: how they make decisions about enabling or blocking access to hormones for their trans patients. So this question is put to a panel member who is delivering a lecture, who is delivering a plenary address, and then the doctor asks how they make decisions about enabling or blocking access to hormones for their trans patients. And the panel member, who has 20 years of experience in trans medicine, responds, it's a sort of like a spidey sense, you know. Then he pauses. You sort of have to feel it about. when the answer say like it's a sort of like spidey sense, and then say like you sort of have to feel it about. It simply reveals that despite having 20 years of training, or despite having 20 years for working in trans medicine, this panel member is not having not properly trained in the trans medicine, and then he makes certain assumptions like you have to feel about it, you have to think like this. Moreover, the medical providers in general are rarely trained in offering gender affirming interventions such as hormone therapy. When we think about the large number of medical practitioners who can be like treating all the trans people, all the LGBTQ people, all the lesbian, gay and homosexual people, but have they been trained with the specific concerns of with their specific concerns? And the answer would be that either no or maybe very less. And if it is like no or very less, then the practice have been from the logic of normativity, from the logic of normalcy. And if so, then what is normal and what is legitimate in trans medicine? And who is a model citizen in a trans medicine? So when we think about like trans medicine, then it raises a problem that that it has to actually resist the call for normativity, the call for normalcy, the call for model citizens, because trans medicine is about equality, it is about equity, it is about equal healthcare opportunities for all. However, the normative medicine says that there are some normal people and there are some like legitimate recipient of medical practices, and there are some abnormal people and illegitimate recipients. Then the normative medicine will say that there are some model citizens, and then there are some citizens who are a kind of freak, who are a kind of citizens who are not model for other patients. Then there comes another question about trans medicine that is based upon evidence. And how does evidence, which in short form is called EBM, the evidence-based medicine, how this evidence-based medicine functions in the context of trans people, and what is its role in the development of trans medicine, how far it has been practical. Then we find that EBM emerged in 1990s, and it transformed the entire medical decisions. It provided a new mode of healthcare facilities. EBM emphasizes the careful and transparent as well as informed medical practice, which is based upon reason, which is based upon science, which is based upon logic. So the purpose, the aim of evidence-based medicine is to provide careful, transparent, informed, scientific, logical, practical medical choices, clinical choices. It also aims to reduce the inconsistency by grounding the decisions in a solid scientific data. So in evidence-based medicine, the data is collected, analyzed, and judged upon, and then the medical intervention is involved. But we also find that despite having EBM's systematic reviewing of the existing studies, EBM is hierarchical, because most of the samples which evidence-based medicines study, they may be from the so-called normative people are those who fit in the normative structure. How much research have been done on the people who are EBM, and then medical facilities are suggested accordingly. Further, the question will be raised that what are the data for the trans people, what is the research on the trans people, and what are the legitimate evidence, legitimate data on the trans people, and then how these classifications have been made. We find that this is very poor in its statistics, and this raises the question on the validity and status of trans medicine, which we call it needs a further question, it needs a further research. More than the questions that has been put on trans medicine, it puts the questions on the normative medicine. It also talks about gender affirming care, which is basic human rights, because the people who are trans people, it is their right to have access to the medical care as per their needs, as per their requirement. However, we find that medical practices are largely normative practices. They have been explored and studied on the people who are not trans, who are not what you call trans-binary or non-binary trans people, those who are not LGBTQ and gay and lesbian people. So this raises some questions about the development of medicine, development of medical practices. What is a trans medical authority? One can consider in terms of gender. Suster says that medical authority is conferred by evidence, experience, expertise. Authority becomes a fraud when evidence and experiences are sparse. But how did providers acquire authority over gender itself? So the trans medical authority or medical authority can, let us assume, are based upon evidence, experience and expertise. But how have one gained the experiences over the gender-based experiences? What kind of data, what kind of research one is having or one has considered based upon gender or transgender experiences? And if it is not there, it may raise some questions. The trans medical authority provides medicalized understanding of gender. What is medicalized understanding? Medicalization refers that there are considers non-medical problems and medical problems. For example, the social concerns, the ethical concerns, the moral concerns are non-medical problems, but they make it part of medical problems. So once like one is not adhering to the social and moral norms, one is not adhering and following the ethical and cultural norms, then in the case of women they are called hysterical. So this is the medicalization of the health concerns of women, that how social, cultural, political, ethical, religious norms define one's health conditions. And similarly, it is also applied in the case of trans people. What is the large of medicine? And then we need to understand what is the large of trans medicine. How does trans medicine work? Since there is like more requirement, more need for research, there is a further need for data study, there is a further need for studying the experiences of trans people. One has to consider the societal problem which the trans people faces. Then one has to actually consider that how trans medicine works over the trans people, or what are the laws of trans medicine. So before we go to the laws of trans medicine, let us briefly think about what is the laws of medicine. And Siddhartha Mukherjee says in his book called the laws of medicine, that the laws of medicine are the laws of uncertainty, imprecision, and incompleteness. For example, like when a person is on the verge of death, maybe because of cancer, because of heart attack, or because of any other chronic illness or disease, then the medicines are given by or with the laws of following the laws of uncertainty, that it may work, it may cure this much. It cannot provide any kind of precise answer that how much it can be like recovered, how much can be cured. It works with the logic of incompleteness. And then when it comes to the like trans people, then these laws are more uncertain, more imprecise, and more incomplete. We find that there are like trans-specific healthcare facilities some places, but basically in US and UK. And but despite being like trans-specific healthcare, the physical healthcare physicians and gynecologists sometimes are the same and sometimes they are the specific one. When we think about the endocrinologists, like who work on the hormones, then there are like trans-specific therapies, there are like trans-specific mental health care and counselors, trans-specific psychologists and psychiatrists. So there are like trans-specific healthcare facilities in UK and US, and also they have trans-specific endocrinological endocrinologists who practice specific hormonal therapies. And as I said that if it is if it works with the logic of what you call incompleteness, uncertainty, as well as imprecision. So when trans medicine acts with the logic of more uncertainty, more imprecision, and more incompleteness, then here is one example which Suster cites, that trans medicine, when we think about the therapy of trans people through trans medicine, and this is about when trans people go the hormone therapy, and when the what you call the hormone therapy is experimental and the provider is inexperienced, and then the people may worry about their health, they may fear about their health, and they also talk about like what they face, and what kind of treatment, what kind of what you call verbal communication they undergo, and how it affects their minds, their mental balance. One of the trans women which Suster describes, and it is her experience about one of her hormonal therapy, where she says, "My doctor has no knowledge in this area and has failed to take any steps to find out." I repeat, my doctor has no knowledge in this area and has failed to take any steps to find out. I have consulted several other doctors. I was met with moral lectures and biblical preachings and disgust. My friend and I need to know what hormones we should be taking, what quantities, what frequency, and what determines this. I am including the prescriptions that we have been on. We were taking the shots once a week and the pills as directed. We have stopped taking the shots as we are afraid we are taking too much. I am off everything at the present. So it talks about their concerns, their worries, their fear, their afraidness about the inconsistency, about the uncertainty, about the inexperienced providers, about the experimental hormone therapies. It talks also about that how some people have are having very less idea about what they are doing. And moreover, that how one is like going beyond their professional practices, that like a doctor is like providing a moral lecture, providing a biblical preaching, that this is something wrong, this is something unacceptable, this is unnatural, this is against nature, it needs to be cured, this is some kind of societal deviancy, it is some kind of physical deviancy, medical deviancy, and says this may be because of certain sins. So these kind of moral lectures and biblical preachings provide some kind of mental disturbance, and sometimes they also make the people who look at them with disgust. They do not find them to be comfortable. They have like no information like how much hormone they are taking, what quantities they are taking, how many times they should take. They are not given sufficient information. This reveals that how their fears have been increased, or how trans medicine is still in the phase of more and more uncertainty, more and more imprecision, more and more indecisiveness. And the people like who are like trans, once like they consult a doctor, they find that or once they consult a practitioner, they find that they have been looked upon, they have what is called like medical gaze, they have been scrutinized, and moreover people have some kind of fascination about them, that how do you feel about your body, what do you think about themselves, yourself. So it is like asking certain questions which are not part of the medical practices. What, for example, like it can also ask some questions. They can also ask certain questions such as that what makes you to be like go for gender transition, and what you need to do after this. So there are a lot of questionnaires for them before they have this trans medical accesses. And then this is a narrative of a doctor, and he talks about his own experience of his treatment to his patient. He says that the patient like who is consulting to him, I have seen him primarily because I was interested in seeing how much breast development a male could accomplish with large doses of estrogen, and other than deserve and talk to him have done nothing. He says that he has no concern about talking to that person. He was only looking that when he is providing large doses of estrogen hormone, then how large one's breast can develop. So it is about like the scrutiny of the body. It is about the fascination of the development in one's body. It is a kind of the medical gaze which is inserted on the body of this person, and then the person is like defined in a particular way. Otherwise, the practitioner says that he has no concern. There was no reason to talk to that person. When we think about the trans people, we also find that they face stigma. The trans people are called trickster people, and it is seen that they use trickster trope to actually dupe their doctors. They have been not trusted, they are distrusted, they are not seen as a normal people. For example, like when trans people, this is a case in US when a trans person is using, a trans woman is using the restroom for a woman, then she is arrested. So we find that despite development of trans medicine, they face social stigma, they face political persecution, they face legal persecution, they are distrusted, they are seen as trickster. So still there are a lot of concerns about trans people which trans medicine needs to address. This is a current case about the trans people in US. In 2018, when the President Trump was in power, then he says that transgender could be defined out of existence under Trump administration, which means that Trump is trying to impose that gender can be only gender as biological, immutable, and so gender is something which is biological and immutable conditions determined by genitalia at birth. So gender cannot be transformed. Gender cannot go, one cannot go for gender transition. So gender is fixed, it is biological. Basic problem occurring over here that gender is not biological, gender is social, cultural, political, ethical. It is sex which is biological. But the government of US, the administration of Trump said that gender is biological. And it has been determined by genitalia at birth. Gender is a social construct. Gender is a medical construct. It is not a biological construction. Biologically, one can decide one's sex. And so I have put one very small, this is like one can Google by oneself. This is a news report by the New York Times. And where New York Times puts that the heading, transgender could be defined out of existence under Trump administration. And then the picture is representing how trans people are protesting against this kind of order by Trump. Recently, 4 days before this lecture, that is on 6th May 2025, we find a report in The Guardian, and the report says that the US Supreme Court has allowed Trump to ban the people who are trans in the military. So the trans military people will be now arrested. They may be banned to get service in the militaries. And so we find that how we have the social and political interventions happening in the life of, in the identity of trans people, and how their identity has been defined, how it has been constructed, and how it has been imposed upon them. It raises further medical concerns for trans people. So to conclude, the purpose of trans medicine is to offer vital support for gender diverse individuals. The gender diverse individuals can be trans people, it can be like binary trans people, non-binary trans people, it can be LGBTQ, and many others. Further, it contests the landscape which is shaped by the ongoing gender politics. So usually we find that there is only gender politics in terms of male and female. It raises the health concerns in terms of the transgender people and their medical needs. It invites inclusive policy and societal acceptance. It needs the inclusive medical policies and how the medical practitioners treat them. It also seeks reducing the stigma of the trans people which they face in their everyday life. So this is a brief lecture about, in general, about trans people. In the next lecture, I will talk about trans people in India. Thank you.